This particular video, we're going to focus on common sources of disability claims. In this particular case, we're going to talk about mental impairments and how they can affect your case. My name is Michael Sullivan. I'm an attorney licensed in Kentucky. It's very fulfilling to see people that suddenly they can get a place to stay, suddenly they can buy food. That's where the magic is. The question always comes, how can you help me? How do we get started? What do we need to do to make a difference today? I can tell you my practice, sometimes you see depression or anxiety, which the agency calls affective disorders. They always accompany a physical problem. People are depressed because they can't do what they used to do. They're more anxious because they're dealing with pain all day. Their coping skills have bottomed out. Usually they're seeing a therapist, a counselor, a psychologist, sometimes a mental health professional. This category of mental impairments, if you think about it, I can take an x-ray of your knee and say, wow, that's an arthritic knee. I can't take an x-ray of your mind and say that's the mind of a schizophrenic. All we can do is look to your mental health professionals, and if they think you're credible and legitimate, we generally fall in line with them. And to underscore that point, when it comes to a mental impairment, the medical records are very essential because there is no objective test for a lot of these problems. The affective disorders, depressions, anxieties, schizophrenias, paranoias. So you tell your doctor what your symptoms are and be honest, because if they don't chart it and it's not in the medical records, it doesn't exist for a judge. You can tell a judge all about it, but it has a lot more meaning if it's also reflected in the medical records. Sometimes people have a pattern, they self-medicate for a while until they get to a doctor and learn that what they have is actually real and treatable. And so sometimes you'll have histories of marijuana use, which is THC on the lab screens. Sometimes there's cocaine, sometimes it's alcohol or whatever. You don't have to be embarrassed about it, you just have to be sure you tell the judge about it, okay? And they'll often ask, when was the last time you used or abused? That's the question you get. It's in the records anyway, they'll find it somewhere, so just be honest and tell them. It's not fatal to the case. Many people don't understand what's going on in their mind, and they look to that first before they go to the medical fields and get a better understanding and more appropriate treatment. Just like any other case, as long as we have the proof, we can do the job for you. If you have any questions about your particular case, anything that might revolve around what kind of proof you need, feel free to call Michael Sullivan. I'm an attorney out of Louisville, Kentucky. If you have any questions about your particular case, anything that might revolve around what kind of proof you need, remember, when in doubt, call your lawyer. I'm attorney Michael Sullivan. Let me know if I can answer your questions.